Well, I sit at a desk, and that's probably why I ended up here.
Yeah.
I had some really tough chronic back pain. Nothing so bad that it was crippling, but I knew that there had to be, it was related to the fact that I was hunched over a desk all day and I wasn't exercising, so everything was going in the wrong direction. And a few traumatic accidents that I had through the years. And I'd been to chiropractors and acupuncturists, etc., quite a few years ago, and I knew that what was going on was probably extensive, and I didn't want to go to a medical doctor and get put on drugs, because I knew that that is not the path that I wanted to go. I knew that there had to be something that I could do that would be more holistic. But I was a little concerned about chiropractic. We had family experiences that were not good, and I never came out of there feeling like they had really done anything. What was it they were doing, and why was it I was constantly going and feeling like there was no plan here? And I went online and started doing some research, and Dr. Gersten's name came up, and I thought, I'm going to give this a try. He's kind of on the young side. Perhaps there's some new techniques out there. And I came in, and the first thing he did was, his whole approach was very up-to-date. He's got computerized equipment that really surprised me. That he has equipment that can actually tell if the muscles and the nerves are communicating, you know, where the skeletal system is lined up without doing x-rays. And I was really excited. Coming in here with one issue, he was able to uncover the fact that I had a problem that stemmed back my whole life since, you know, I was a kid. And I did not give him a lot of information, but he came back and said this and this and this, and he was right on the mark. And I was very happy with the approach. He sat down with a plan and said, this is not going to be forever. You're not going to be coming in here twice a week forever. This is what I want. I want you to be on a maintenance eventually where you come in maybe once every 3 to 6 months. And I thought, yay, that's going to look much better on my checkbook. I did start out with the deep tissue work because my body was so tight and tense from not exercising and having these chronic issues tighten everything up in my back. But after doing that for quite a few weeks, he finally released me to the exercise program, and I am just thrilled with it because I feel really strong. My body is finally showing changes that are really positive I've never seen before, and I'm just really thrilled. He wants to get me to where I'm out there on my own, and I do now exercise on my own at home, and I didn't think I could do that. And I do have a background. I was a professional dancer and a gymnast and all of that, and I just, if you don't keep doing it, your body changes and it just, ugh. But there's a basic structure still there, and your body memory comes back, so it does work if you really push yourself. And it's hard. I find it challenging, but nobody here makes me feel bad when I haven't been exercising. I come in and I realize that this is a new day, and I'm going to be working with Leslie, the physical, the exercise therapist, and then I'm going to go out there and work at it again. And it is a really positive atmosphere. Everybody's supportive, and I don't feel like, ooh, which is something that people relate to. Oh, chiropractors, aren't they they're out there in that other world? I find that the medical profession is in support of these other alternative forms of medicine or whatever, holistic healing, and my doctor's very supportive of it. So I did go in for a physical last week. I've been here with Dr. Gersten since the end of February, and the last time I had a physical, the blood pressure was up, borderline diabetes, my weight was up. She had a lot of concerns. I was having heart palpitations, racing heart, and I'm thinking, oh, no, this isn't happening to me. And I went in this past week and she said everything is normal, and I don't have to start on any of those medications that people start after they reach a certain age. So I was thrilled, and gave me a shot in the arm for moving on with this program with more enthusiasm. So
amazing.
I really find it to be rewarding. And I know a lot of people are afraid, chiropractors, what they can do to my spine. I have never found anything startling or frightening about coming here. It feels like a normal process.
That's awesome. Was your doctor, did you attribute the benefits in, you know, lowering your blood pressure and all that to this, and was your doctor supportive of that? And
she was real supportive. I think that a lot of it has to do with me getting on the exercise again, and I know that I was in too much pain and discomfort to maintain any kind of exercise in my life. So Dr. Gerson's approach, it took almost 6 or 8 weeks before he put me on the exercise program. And I think that in itself, he helped my body to release all its craziness, and then to be able now to work in a normal way in the exercise. And that in itself has helped my body to lower the blood pressure and get the cholesterol where it should be, etc. But it did go back to my body was all twisted up and tightened up, and it needed to be released and straightened out. And I think that, yeah, she didn't talk a lot about it, but she was real happy with whatever it was I was doing, and I did express to her what it was.